Hi, good evening, and welcome everyone to tonight's Foundation Years event. I'm Seb Thorpe, and I'll be your host for the evening. As you'll know, this is Foundation Year's first event for quite some time, so we're thrilled to have you here with us tonight. Thank you all very much for taking the time to join us. We understand that this may have been a challenge for various reasons, so your attendance is very much appreciated. Thank you. I'm pleased to welcome you to tonight's session, Safeguarding Excellence, Protecting Our Youngest Learners. Safeguarding, as we all know, is of such vital importance in all of our work. And this evening we'll hear and explore all about it from multiple perspectives, ensuring that we leave here with some practical strategies to take away into our settings and have a deeper understanding. Before we explore today's topics and hear from our speakers, I'd like to take a moment to introduce Begin Bright, who will be a new name to many here on the call. Begin Bright are part of Cognition Learning Group, and we're a global group who've been operating our services through various brands here in the UK for 15 years, and we're a key provider to government, working on various government contracts. Earlier this year, Begin Bright were named as the new delivery partner for the DFE-funded Foundation Years programme to provide a range of services and support to early years educators from all specialisms by promoting sector updates, policy and guidance information, resources, and further support. Since July, we've been posting regularly across the Foundation Year's social media channels, publishing monthly newsletters, and creating and posting various resources to the Foundation Year's website, in addition to making updates to the website itself. Thank you to everyone who's been engaging with the Foundation Years programme and its services over the past few months. We really do appreciate that. And please do continue to engage with us, as this is really vital in us delivering a high quality service. And moving on to this evening's event, we have 4 fantastic speakers lined up. Firstly, we have Olivia McNeil from the Department for Education, who will walk us through the latest safeguarding reforms for the early years foundation stage. Next, we have Tracy Dunn from Anaphylaxis UK, who will share her insights on allergy awareness in early years settings. Following that, Gail Murphy from the National Day Nurseries Association will talk us through how we can build a safeguarding culture within our settings. And finally, Elizabeth Kemsley, Nursery Area Manager and Safeguarding Trainer from Nurture Childcare, will discuss holistic safeguarding, managing allegations, and whistleblowing. And very quickly, before we begin with our speakers, just a few housekeeping points to be mindful of. The session will be and is now being recorded, and the full recording will be available online following the event. The Q&A function will be open throughout the presentation. It will be open now, so please feel free to leave questions in that toolbox all the way through the presentation, and we will come to them later at the very end when we have a dedicated Q&A session. The chat function is disabled, so make sure that you leave any questions in the Q&A section, not the chat function. We do have the reactions function available throughout, and that will be functional throughout, so please do get engaged with us and all of the other speakers that we've got presenting tonight. Engagement is very much encouraged. It'll be great to see lots of thumbs up there, so please feel free to get engaged with that. Really appreciate that. As I mentioned earlier, we're very fortunate to have Olivia McNeil from the Department for Education with us tonight. Olivia will now talk to us about the latest safeguarding reforms in the early years foundation stage, and that will help us understand the policy changes and how they'll impact our daily work. So thank you very much, Olivia. Over to you.
Thanks so much. And hi, everyone. Thank you so much for being here. So as has already been said, I'm Olivia McNeil. I'm a senior policy advisor at the Department for Education, and I've been leading on the early years foundation stage safeguarding reforms that I'm going to talk to you about today. So in this session, I'm going to provide some background to the reforms. I'll run through the changes that we're making to the EYFS, and then I'll provide answers to some frequently asked questions that we've heard from the sector throughout the engagement and consultation that we've done so far. So starting with some context, if we just go back to the previous slide, context on the upcoming EYFS changes. DfE continually monitors and reviews the safeguarding requirements that are set out in Section 3 of the statutory early years foundation stage framework, and that's the framework that registered early years providers are required to follow when they're caring for children from birth to 5. Following extensive engagement with sector and safeguarding experts, we developed a number of proposed changes to the EYFS to ensure the requirements are comprehensive and suitably robust to help providers keep children as safe as possible. So we consulted on proposals between the 22nd of April and the 17th of June 2024, and we received 1,470 responses. We've now published our official response to that consultation on gov.uk. The consultation found strong support from respondents for all of the proposals that we consulted on, with clear consensus that the safeguarding reforms will improve children's safety and align with current best practice in early years settings. So based on responses, ministers have decided to proceed with implementing all of the proposals that we consulted on. Our hope is that these changes will provide early years educators with the clarity and support they need to deliver the highest quality, safest early education and childcare provision possible. So running through the key proposals that we'll be implementing, the safeguarding changes include amendments to promote safer recruitment. So that includes new expectations to provide references, requirements to obtain employment references, and a requirement for safeguarding policies to include procedures to help ensure that only suitable individuals are recruited. There are new requirements for following up on child absences if a child is absent for a prolonged period of time, and amendments to ensure that providers hold additional emergency contact details. There are new requirements to ensure safer eating, so that includes requirements around allergies and anaphylaxis, introduction of solid foods, and choking prevention. We've created a new safeguarding training annex that's going to be an annex in the EYFS and sets out minimum criteria for effective safeguarding training, so what training courses must cover. There's a safeguarding training renewal period of every 2 years and a requirement for safeguarding policies to include details of how safeguarding training is delivered, including how practitioners are supported to put it into place. We also have amendments to ensure that early years students and trainees are required to have paediatric first aid training in order for them to be included in ratios at the level below their level of study. New whistleblowing requirements to make it clearer when and how to escalate safeguarding concerns and to support practitioner confidence with regards to whistleblowing. Amendments to ensure that children's privacy during nappy changing and toileting is considered and balanced with safeguarding considerations, and a small number of other minor changes to the structure and wording of the safeguarding requirements to improve clarity. So for further detail on all of the safeguarding proposals individually, including the responses to the consultation and the reasons behind the decisions made, please do go take a look at the government's consultation response. So moving on to when will changes be implemented, we want to give the sector time to prepare for these mandatory changes before they come into force. And therefore, the department is aiming to bring the changes in for the 1st of September 2025. Ahead of then, we'll carry out a programme of communications and engagement, working with the sector and local authorities to ensure they understand the changes being made and how to implement them. To support with this, DfE has published a page on foundation years with further information and resources on the safeguarding changes. So this includes a vodcast, a table summarising the changes with the exact EYFS wording, and a poster to help you communicate about the changes to other educators. The department's Help for Early Years Providers website also offers guidance for people who work in early years, and this includes guidance on food safety and internet safety, alongside a whole range of other topics. So now moving on to some frequently asked questions that we've received from the sector and local authorities throughout the consultation process. First, when thinking about the new requirement to obtain employment references, we've been asked how this requirement can be met when obtaining references for students who haven't previously had a job. So the new requirement on obtaining references sets out that references should be from the candidate's current employer, training provider, or education setting, and be completed by a senior person with appropriate authority. That gives appropriate flexibility to seek references for candidates who've not previously had a job. Another common question has been on whether references can be obtained from a potential future employee's family member. The new requirement on obtaining references sets out that providers or childminders should not accept references from a family member. As the wording for this new EYFS expectation is a should rather than a must, providers are required to take this into account and should not depart from it without a good reason. On child absences, we've been asked to define what a prolonged absence is, with some consultation respondents asking if we could assign a timeframe to this in the EYFS. So we haven't done that, and that's because the EYFS wording is written to give flexibility for providers to use their professional judgment to decide what constitutes as prolonged, and this will be different for every child. Consideration must be given to patterns and trends in the child's absence, their vulnerability, their family, and home life. We're also aware of concerns about difficulties collecting emergency contact details for some families. For example, those who've recently arrived from abroad or those who speak English as an additional language. As the wording for this new EYFS expectation is should rather than must, providers are required to take the guidance into account and should not depart from it without a good reason. So this offers flexibility for cases where it's not possible to collect more than 2 emergency contact numbers. So this question asks why we shortened the safeguarding training renewal period in the consultation response. So we originally proposed that safeguarding training must be renewed every 3 years and that providers should consider whether staff need to undertake an annual refresher within that 3-year period. Most consultation respondents felt that safeguarding training should be renewed annually for safety reasons. However, there were also clear concerns raised about the burden of more regular training on providers. Therefore, we're implementing a renewal period of every 2 years to strengthen safety further while reducing the burden that annual training would put on providers. With this shorter renewal period, providers may consider an annual refresher will be less necessary for all staff. So the wording of the expectation on annual refreshers will be amended to reflect this, with should replaced by may. I also want to flag that throughout the consultation, there were concerns raised about the availability and quality of existing safeguarding training opportunities and calls for more accessible, high-quality safeguarding training. Therefore, we'll continue to consider what more we can do to support the sector with undertaking safeguarding training. So in relation to the proposal on PFA training, the question here is, what if students, volunteers and apprentices do not have the experience or confidence to be included in ratios at the level below their level of study? The EYFS requires that staffing arrangements must meet the needs of all children and ensure their safety. There's no requirement in the EYFS to include students, volunteers and apprentices in ratios. And if providers feel this would impact safety, they must not do so. Students, volunteers and apprentices may be included in the ratios at the level below their level of study if the provider is satisfied they are competent and responsible. Only where they are included in ratios will they need a PFA certificate, and this will increase the number of PFA trained staff in settings and enhance safety. And finally, we have also had questions on how to balance the proposed new requirement for privacy during toileting and nappy changing with ensuring adequate supervision of all children in their care, in particular for educators who are working alone. The proposal is clear that children's privacy must be balanced with safeguarding, and in some cases, such as for lone childminders, this may mean a childminder meeting a requirement by using themselves or a privacy screen to shield a child and maintain their privacy while still ensuring adequate supervision and safety for other children. Thank you so much. That's everything from me, and I'm happy to answer any questions later on.
Wonderful. Thank you for sharing that, Olivia. Much appreciated. That's really helped explain in clear terms the recent safeguarding reform. So once again, thank you very much. To repeat what Olivia's just stated, if there are any questions in relation to the information shared there, please do leave those questions in the Q&A tool that you'll see on the top banner on your screens, and we will address those later during the Q&A segment. Thank you very much, Olivia, once again. It was great. Thank you. Next, we'll be hearing from Tracy Dunn. Tracy is Education and Allergy-Wise Manager at Anaphylaxis UK, who will talk about a extremely critical element of safeguarding allergy awareness. With a range of allergies and intolerances on the rise, it's important that we know how to protect children from these risks. So really looking forward to hearing Tracy talk on her area of specialism. So Tracy, if you wouldn't mind sharing your insights, please, that would be wonderful. Thank you.
Thank you. Thank you very much. Hello, everybody. So Anaphylaxis UK is the only UK-wide charity which operates solely for the growing numbers of people at risk of serious allergic reactions and anaphylaxis. And we've been in existence for 30 years, and we're continually working to make the future brighter for people with serious allergy. I'm actually a retired executive head teacher, and so I've got practical experience of leading allergy-aware schools. I volunteered as education ambassador for Anaphylaxis UK for 10 years whilst I was a serving head teacher. And this is because I'm a parent of 2 teenagers with allergies, one with food, peanut, kidney beans, who needs adrenaline auto-injectors, and my other child has non-food allergies and is undergoing immunotherapy for severe grass pollen allergies. With anaphylaxis, there is always a tricky word to get your tongue around. So at Anaphylaxis UK, we have been considering the hidden battle with allergies over this last year. And in this presentation tonight, I want to talk to you about what an allergy is, the difference between an allergy, an intolerance, and celiac disease. And then I want to talk to you about allergies, some statistics and the legislation, but then crucially, signs and symptoms of allergy and anaphylaxis within early years focus, because it can be slightly different with our younger children. And then ways that you can practically create a safer environment for the young people in your care. So we have our first picture, which will be allergy, and allergies are an appropriate or an exaggerated reaction of the immune system to substances that for the majority of people cause no symptoms. So the first stage of allergy is sensitization, and this is where a person is exposed to a food or substance and their immune system registers it as a potential threat. In some of those people, but not all, a future exposure to that food or substance will cause an allergic reaction. An intolerance is different, and an intolerance is when a person has difficulty digesting certain foods or ingredients in that food. A food intolerance occurs when a person can't digest those and they have discomfort such as bloating, stomach pain, or diarrhea. So these symptoms are different from the symptoms from allergy. And whilst a food intolerance will make a person feel uncomfortable and unwell, it will never be life-threatening. And unlike a food allergy, a food intolerance is not caused by the immune system overreacting, which means that you can't have that serious allergic reaction. Celiac disease is a little bit different again, and celiac disease is a condition where the immune system attacks its own tissues when you eat gluten. That attack damages your gut, your small intestines, so that your body then cannot properly take in nutrients. It's an autoimmune condition. It does have similar digestional systems like an intolerance, but in addition to those, it has other symptoms that could include fatigue, unintentional weight loss, itchy rash, nerve damage, and disorders that affect coordination, balance, and speech. It's not life-threatening again. So out of the 3, the only one that can be life-threatening is allergy, although all 3 will make a person, a child, very poorly. So moving on to thinking about some legislation and guidance. And we've heard Olivia talk about safeguarding and those changes that are coming to the safeguarding practice that settings are going to have to embrace. And in context of that, we have got some statistics around the fact that allergic disease is rising and it is continuing to rise. There are 3 million people in the UK now who suffer from allergic disease, and 8% of those are children. This means that there is and there will continue to be an increasing number of children in early years settings with allergies. 40% of parents of children with allergies suffer from moderate to extremely severe anxiety. And 42% of that group meet the clinical threshold for PTSD. And initially, that may seem quite surprising. But when we consider that many parents find out that their child is allergic during an anaphylactic reaction that's left their child extremely poorly, it becomes much more understandable. And this helps us to understand the anxiety that parents feel and have to manage when they pass the care of their child over to an early years educator, as they have to have blind trust in that educator. Early years educators are supported by working with children by these 3 key documents that I've got displayed on the screen. Each document is clear in the expectations that the early years setting must undertake and understand. For example, in the nutrition document, it details that settings must find out if a child has got any allergies before they join the setting. It also details that staff need to be able to recognise signs and symptoms of an allergic reaction, especially as children may be trying some food for the first time at the setting. This means that training for all staff is essential, as the knowledge of signs and symptoms cannot remain with 1 or 2 members of staff. In the early years safeguarding changes that we've already talked about, it's clear again that all staff must know the signs and symptoms of allergy and have ongoing discussions with parents and carers, so that allergy action plans can be developed and ensure that there is the clarity of responsibility around meal times, making sure that every child receives the correct food. The early years foundation stage statutory framework supports settings to understand their responsibilities with regard to both medicine and food. It sets out the curriculum to be covered in paediatric first aid, which includes being able to help a child having an allergic reaction. Wherever possible, this paediatric first aid training should be supplemented with specific training on allergy and anaphylaxis, because the only really safe way to manage allergy is the prevention of a reaction occurring. So on the next slide, we will see some pictures of some allergic reactions happening. There are 4 key symptoms of allergy as displayed in those words on the slide. First of all, there is a red raised rash, which is known as hives or urticaria, which is anywhere on the body. Children might have a tingling or itchy feeling in the mouth. There may be swelling of the lips, face or eyes, and there may be stomach pain or vomiting. Now, the children may only have one of those symptoms at any one time, so they can happen in isolation. An allergic reaction doesn't mean that somebody will automatically have all of those symptoms. And stomach pain or vomiting can be really tricky. So it's really important to be curious and keep an eye on a child who has a known allergy and is feeling sick or is vomiting after eating. It could be a reaction, but it also could be a tummy bug or anxiety or a stitch if they've been running around. It's important to note that swelling doesn't have to be symmetrical, and that hives can be large, they can be small, and they can vary each time a reaction happens. And with allergy, it's really important to understand that no reaction is ever the same as a previous one, and it doesn't give us an indication that it will be the same as the next one. There are lots of words on the next slide, and that's because I wanted to particularly highlight the signs and symptoms of anaphylaxis that you are most likely to see with a younger child in the earlier settings. So anaphylaxis is an extremely serious reaction and requires emergency response. It always involves the airway, breathing or circulation. And the text in red are the symptoms that the children in early years are most likely to display. So they may suddenly become very sleepy or very tired. You might hear them coughing. You may have them trying to explain what their throat feels like, or they might have their sore throat and swelling in that throat. Anaphylaxis can come on suddenly, but it doesn't have to develop from the symptoms that we saw in the previous slide. They are likely to involve a skin reaction in a younger child. And in a younger child, in addition to the face, lips and tongue swelling, their feet might swell too, which is significantly different from an older child or an adult. In addition to the vomiting and stomach pain, they may well have diarrhea. In an older child, you won't necessarily have the diarrhea. They may have sudden behavioural changes. They may have inconsolable crying. They may become really clingy. They may become really a lot less active and refuse food. And these are key differences that those involved in the earlier settings need to be aware of and are not necessarily covered when you are doing your PFA training. With babies, you may find them actually, and young pre-verbal children, using their hands to pull their neck or pull their tongue because they've got swelling happening. And so actually working out when an allergic reaction is happening is a bit like being a detective at times. So the best way to manage allergy is to prevent allergic reactions from happening in the first place. Hopefully on the next slide, you'll be able to see a few picture clues that I use to help me remind everybody the things that we need to put into place for good allergy management. And so the telephones represent communication between parents and carers and staff. It's really essential. Parents and carers will have had to have educated themselves rapidly when they first learnt that their child has allergies. And so they will be a font of knowledge on how allergy presents in their child and have great advice on how they manage it at home and out and about. It's really crucial to listen to their fears and concerns and together agree a management plan that's reviewed throughout the year. It's important to share risk assessments and ask for their input and advice where necessary. The books represent learning. Our whole setting approach to allergy management will see the child throughout the setting and their parents learning about allergy. So that's not just the children in the room or the stage that they're at in the setting. It's everybody in the setting learning about allergy, and story is a great medium in order to do this. When the children are speaking, they should be taught to ask, is this safe for me? And a setting approach that encourages children to ask, is this safe for me? That adults can encourage them to happen is really empowering. And actually, is this safe for me, when asked to an adult, will actually make that adult stop and think. And so it's really good practice in order to be able to encourage the children to start being proactive about managing things for themselves from a very young age. Awareness events can be held within the setting to raise awareness with all of the parents and carers beyond the standard communications. The picture with the children with the safety goggles is about health and safety, the risk assessments that are vital in order to inform decision making and make sure that the decisions that are being made are coming from a place of safety. And is it necessary to eliminate an allergen from activities, from a room, or for a whole setting? Often parents and carers will want a ban on the allergen because they believe that this will make the setting safe for their child. However, it's not always the case. Banning an allergen is a complex process that must only be done when all other control measures have been exhausted, and it's the only way to make the environment safe. Adrenaline auto-injectors should be wherever the child is and move around the setting with them. They should never, ever be locked away. Children are naturally curious, but they will learn that they have to respect the rule that it contains important medication for their friend and can't be touched by anybody other than adults. It can be stored at adult height on pegs or shelves in the room. And as talked about previously, training in whole setting allergy management is really important rather than just relying on only having the core content of paediatric first aid training. On the next slide, we then can think about the food. And food is crucial. That's where the majority of allergic reactions will stem from. So all staff need to know who is responsible for ensuring that the child with allergy gets the food that is safe for them. All staff need to understand how allergens are labelled, how to safely prepare food for children with allergies, and the systems in place to support children with allergies are not therefore being exposed to cross-contamination. All the staff need to know about allergen labelling on packaging and what may contain means. Hand washing, hygiene. Hygiene is one of the major factors in allergy management, and this involves everything in the setting being cleaned regularly, not just tables and hands. Consideration needs to be given not only to cleaning after use, but before use too, to remove any cross-contamination that could have occurred between use. It's also important to consider the products that are being used, particularly by staff, and ensure these do not have allergens in them, for example, hand creams. With toys, the risk assessments that the setting is undertaking will determine whether babies or toddlers need to have separate toys in order to ensure their safety, or whether this can be managed in other ways. And this will be particularly important when a baby or toddler has a milk allergy and is using anything that is likely to go into their mouths. Anything that's likely to go into a child's mouth should be cleaned after use and on a daily basis. Thank you. That has been a really whistle-stop tour through allergy, and at some point I will be delighted to elaborate on that at other events. So any questions, please pop them into the Q&A and I will do my best to answer those for you.
Wonderful. Thank you very, very much, Tracy. That was extremely insightful, and I've definitely learned lots of new things there that I'll be taking away. So thank you very much. I'm sure it's the same for many people on the call as well. And to repeat what Tracy's just said, if there are any questions, please do share them within the Q&A tool, and we can address as many of them as we can as we progress towards the end of the call. And now we move on to another of the core elements. Well, they're all core elements, but another really core element of safeguarding, which is building a safeguarding culture within our setting. So Gail Murphy from the National Day Nurseries Association will guide us through the essential steps to creating that environment where safeguarding is a priority at every single level. So over to you, Gail. Thank you very much.
Thank you. Hello, everyone. I'm really pleased to be able to talk with you today, and thank you for the invitation to the event. NDNA obviously welcome the additional safeguarding measures that are being proposed, and feel sure that the strengthened requirements will improve safety for all our children in our early years settings and nurseries. So my name is Gail Murphy. I'm the Early Years Development Manager at NDNA, and I'm responsible for the development of training, publications, resources and materials to support and develop practitioners to improve the quality of provision for children. And I'm also the designated safeguarding lead for the organisation across the 3 nations of England, Scotland and Wales. So in the new requirements, it's been recognised that while practitioners receive regular safeguarding and child protection training, how to implement that training on a day-to-day basis is not always as effective as it could be. Ensuring training is effective for the age group of the setting understanding staff roles and responsibilities, including those of the DSL, knowing how to build a safer organisational culture and reflecting on practice are crucial aspects for safeguarding our youngest and most vulnerable children. It would be really great to get some real-time responses to the presentation. Please use your thumbs up to react to the content at any time. So often the terms safeguarding and child protection are used interchangeably in order to mean the same thing. However, each does have a specific focus. Safeguarding is about how practitioners and settings can prevent harm to children through implementing effective policies and procedures, meeting the minimum statutory requirements, but also hopefully going beyond so that there is the least possible risk of harm to children. And child protection is everything that professionals and families around a child will do in order to respond to any harm which may have occurred. My focus today is on safeguarding, what we need to do as early years professionals to prevent harm. My biggest fear was that there was going to be something that I did or didn't do, which meant that a child in my care had slipped through the cracks and had become subject to harm which could have been prevented. Policies and procedures are all very well, but you need to make sure that your staff know about them and are confident to follow them. In my experience, when it's clear that there's a safeguarding concern, such as when a child or an adult makes a disclosure, staff are confident to follow that process. But where the lines are more blurred, such as in the case with neglect or emotional abuse, knowing how to safeguard a child effectively is less clear. Consider the scenario where a child arrives at nursery with a nappy that's falling off because it's so full. Will that be an example of neglect? But the context for the child's lived experience is required to support us to make that decision. For example, is it a one-off? Does it happen every day? Has it just recently started happening more? Are there any other concerns around the child and family? Does it meet the definition of significant harm? This definition is taken from the Children Act in 1989. Two messages from that which everyone needs to be clear of are that safeguarding is everybody's responsibility and never do nothing, always do something. Whether it's the chef, the room leader, the director, the maintenance staff, the apprentice or the student, from the moment that they are in your building or on your grounds, they must take responsibility for safeguarding the children. And with that responsibility is that motto from Laming about making sure that you do something. It doesn't matter if it turns out to be nothing further down the line. No staff member, no parent, no inspector is going to criticise you for making a decision and raising a concern based on that decision. On the other hand, if you do nothing and later find out that the child has been subject to abuse which could have been prevented, then every laddo, inspector and judge will be within their rights to criticise. As I mentioned before, staff are usually confident when addressing clear-cut messages about a child at risk of harm. But what about those low-level concerns? When things don't seem bad enough to say that a child meets that threshold of significant harm. They attend nursery every day, mum clearly loves them, but there are those niggles. Mum's stories about why the child doesn't have the right shoes on just don't seem to ring true. When grandma brings and collects the child because mum is unwell, but when you see mum, she's got an old bruise on her face. Low-level concerns are not insignificant. So what is a low-level concern? So a low-level concern is any concern, no matter how small. It is that gut feeling, it's that sense of unease, it's that nagging doubt. It's something that it doesn't meet that threshold of harm. You're not going to refer it to the laddo, but you still feel that you need to do something about it. And it refers to the adults who are part of the settings community. We need to be aware that it could happen here. Sadly, we know of settings where safeguarding has not been at the heart of their practice, as shown by these recent events. I'm sure we're all aware of Oliver Steeper, the 9-month-old baby boy who was unable to eat solid foods. The former worker is Andrew Evans. He had worked for around 20 years in a number of childcare sectors, including voluntary work and babysitting, and he was found guilty of sex offences, including assault and indecent images. Kate Ruffley has been a prominent name in the media this year after being found guilty of strapping 9-month-old Genevieve Meehan to a beanbag, leading to asphyxiation. And Rebecca Gregory worked at the same setting as Ruffley, and she was charged with child neglect. As a profession, we tend to be kind, caring people who want the best. And as such, we can find it difficult to think the worst about others, especially our colleagues. Yet we know that many of our current safer recruitment practices have been brought about following serious case reviews, such as carrying out pre-employment checks, having DBS checks, ensuring our interview questions explore the reasons for a candidate wanting to work in an environment with young children. And other wider requirements became statutory as a result of employees' actions while in a nursery setting. So the mobile phone and camera use restrictions, for example, brought in as a direct result of an employee abusing their position in a setting. And yet people still slip through the cracks and become part of our workforce. So when thinking about professional curiosity, we often focus this on the parents and carers of our children. Is there something that doesn't feel right? Does something not quite add up? This in itself can be quite difficult to address. Should I talk to the parent about something I've heard on the grapevine or seen on social media? Is the child telling the truth? But they're professionals and they live in that gorgeous house. And we need to remember in these cases that we need to consider what life is really like for the child. There's professional curiosity with our colleagues. Those questions and uncomfortable feelings may be just as true about a colleague as they are about a parent. So what do you think we should do? Hopefully you're all thinking whistleblowing. Whistleblowing is a confidential report of concerns regarding a colleague, whether another practitioner, the manager, or a director, and I know that Elizabeth is going to focus more on that later on. Remember, it could happen here. The most effective way of safeguarding the children in your care is to genuinely put them at the centre of all that you do. Working together to safeguard children recommends a child-centred approach with a whole family approach. And this means that anyone working with children should see and speak to a child, listen to what they say, observe their behaviour, take their views seriously, and work with them and their families and the people who know them well when deciding how to support their needs. With little or no language to communicate their needs, either because of their age, their developmental stage, or a home language, all methods of observing and communicating need to be explored. Remember that this makes these children more vulnerable to abuse, and so it's more of a reason to make sure that you put them at the heart of your practice. Partnership with parents is crucial. Form those positive relationships right from the start, so that if you need to have a difficult conversation, it's in the context of previous easy conversations. Make sure there's no surprises for parents, whether that's what you talked with about the health visitor, what views you share in a child protection meeting, or who'll be coming to visit their child in the setting. Open, honest, respectful relationships built on empathy and compassion will always benefit the child, whether there's a courageous conversation required or not. Remember to include male carers. Remember not to stereotype. Try not to make false assumptions, and always help parents to understand what the issues are and how those impact on the child. I use this last point most when there's been domestic abuse in the household, or maybe when there are acrimonious separations. Parents often believe that conversations, arguments, and arrangements are made away from the children, but they often forget what the atmosphere is like at home, what Dad says to Gran when he drops the kids off, what they hear when Auntie is on the phone to Mum. Letting parents know that their actions are impacting on their child is a tricky conversation to have, but you must have it so that they can take action to put the child at the centre of whatever is going on. So, as Olivia mentioned before, part of the updated safeguarding requirements for September 2025 is going to include an annex, which contains the criteria for effective safeguarding training, so that all settings will be clear about what staff should know and be able to do in order to be able to be adequately trained in effective safeguarding. NDNA has already updated its safeguarding training to reflect this criteria on the basis that it's best practice. Included in the criteria is a statement that training for the DSL must include how to build a safe organisational culture. So what's meant by a safe organisational culture? These first four, the policies and procedures, safe recruitment, professional curiosity and the child-centred approach, I've covered already. And these other aspects are part of a safe organisational culture. I can't cover all of these today, so I'm going to focus on the staff safeguarding competences and the DSL role and responsibilities. I'm not diminishing the importance of the other aspects. They're clearly crucial to ongoing effective safeguarding practice in your setting. Safeguarding competences do you expect from your practitioners? Some ideas are noted here. And when planning your safeguarding training, consider what safeguarding competences you wish your staff to have and base your training around those. It'll also be valuable to consider how you'll monitor and review your staff safeguarding competences, whether that's through supervisions, peer observations, exploring safeguarding scenarios in staff meetings, or sharing updates throughout the year. The annex will make it clear what the minimum expectations for all staff is to be. So your designated safeguarding lead and any deputies will be expected to have additional roles and responsibilities to those of the other staff. One of the main requirements of a DSL is availability and time. We never know when a child will be in need, and once a concern has been raised, this must be your ultimate priority until such time as you're satisfied that the child is no longer at risk of harm. Availability and time sounds so easy, but in my experience, that can be the biggest challenge. And then the DSL needs to be liaising with other professionals as required, whether that's health visitors, the LADO, the IRO, the independent referral officers. They will also need to be managing the referrals and all the information related to safeguarding and child protection records. And also they'll need to be raising awareness with staff and parents, and that includes training and skills. Can support settings with training and skills through our courses and publications and fact sheets. So thank you very much for listening. Thank you for your feedback with your emojis. Thank you very much for your time this evening.
Thank you, Gail. Another wonderful presentation there. Thank you so much. Really insightful once again. Lots of really usable examples and strategies that we can take away into our settings and into our daily roles. So thank you once again. And to repeat, any questions for Gail, please do leave them in the Q&A tool, and we can pick those up at the end of the presentation. And moving on to our final speaker of the evening, we have Elizabeth Kemsley, area manager for a nursery chain, and also a safeguarding trainer at Nurtured Childcare. So over to you, Elizabeth. Thank you very much.
Hi, thank you, Seb. So yeah, I have got a wealth of experience in all elements of safeguarding children in early years, with lots of experience of working in disadvantaged areas, having supported many children and families in my various roles in nurseries. Sorry. So this evening, I'm going to be covering the following aspects of safeguarding, holistic safeguarding, managing those staff allegations, whistleblowing, and applying knowledge to everyday practice as well. So you can't see the wood for the trees. With all safeguarding, the key is to ensure that a clear picture is always formed. It's so important to put all the information together before making those decisions, recording and considering even small bits of information, particularly as these often make up that bigger picture. And if you're unsure, even after getting all the information together, you can still seek advice, and it's always better to be safe than sorry. So holistic safeguarding, this term covers all organisational approaches to becoming an all-encompassing safe setting for users. It embeds safeguarding practices that create strong and effective safeguarding cultures. And there's so much that comes under the term, but in settings in particular, these do include understanding children's lived experiences and circumstances, know the child and their family, build those relationships. There should be a multi-agency approach and information sharing. You should know who to contact for support, find out about those local safeguarding teams and support services and how to refer to those. Gain the appropriate skills and knowledge to help understand and reflect on the voice of the child. Know the children in your care well. Practitioners regularly trained in identifying abuse and knowing what to do with that information if they have their worries is also key. Policies and procedures, staff working with children need these to be clear with the expectations that they need to follow, telling them what to do in those different circumstances. Risk assessments and health and safety practices, keeping the physical environment safe for children on that daily basis and making sure all of their needs are met, including health needs. Prevention, early identification and intervention, giving parents and carers information to inform them of how to safeguard their children. Again, know your local support services and their contact details, as this can all prevent issues for children escalating to those higher child protection levels. If concerns must be addressed, practitioners need to be confident to record this, say something isn't right and challenge that, and have those difficult conversations with parents, as well as seeking advice in a timely manner. We should be able to recognise the signs and symptoms of abuse and have an in-depth knowledge of the categories and the indicators of these. Signing in and out and keeping a record of visitors, know who's in the building, who's got access to our children, check ID and even DBSs for those regular contractors. The medication, accident, incident forms and pre-existing injury forms. Record keeping is of course key. It helps to build that picture of what is happening. Accuracy is really important and it must be kept confidential at all times and only shared on that need to know basis with relevant people or agencies. We also need to understand the different ways children communicate. If children haven't got that language to tell them, that's where we need to be listening to them, observing the behaviour changes, be curious as to why these things are happening and what acts where needed. There should be effective supervision, asking the right questions, ask practitioners about concerns they have regularly, check their understanding with regular questioning, check they've followed procedures if they've had those concerns. Mobile phones, smartwatches and devices, settings and practitioners need to be aware of the dangers of these to children. They're ever evolving and without that careful supervision and use of these in the settings, children will be at risk. We need to be able to identify the most vulnerable. All young children might be vulnerable to harm given their age and reliance on adults, but we need to be aware of children's individual circumstances, such as any special educational needs and disabilities, their home and family life, so that we can be alert to any concerns. Safer recruitment, it's really important in early years those checks are made. Recruiting new practitioners, we need to be checking those gaps in employment, references, DBSs, and these should always be followed by strong inductions along with regular supervisions and training after employment. And finally, whistleblowing. Practitioners need to know where they need to report poor practice or anything that worries them. They must know when and how to do this. Settings need to create that culture where people are proactive and acting on concerns, and settings have to take these seriously and act on them correctly. So what happens when we don't holistically safeguard children? There's a couple of examples here where this was not successful. So we have Daniel Pelker on the left. He died age 4, invisible to professionals. He'd had much contact with professionals throughout his short life. He'd been to hospital with a broken arm, presented with bruises at school. School reported him scavenging for food in the bins. There were visits to his family home from social workers and health visitors, but these all failed to check on Daniel properly. Poor attendance at school wasn't challenged by school staff, and a further factor was that English wasn't his first language, so nobody spoke to him and explored what life was like for him. Professionals were never curious enough, failing to check on him at visits, not challenging the parents about his diet, and not communicating with each other about the concerns. On the right, we've got Vanessa George, who used the mobile phone to take pictures of herself abusing up to 30 children at the nursery she worked at. She then sent these to her partner, who shared the indecent images of the children in the nursery over the internet. She regularly insisted on changing children herself in the bathroom with the door closed, enabling her to carry out the abuse and photograph this. Staff weren't confident to whistleblow. They didn't feel they could challenge her behaviour, and they did become increasingly uncomfortable, but they didn't know where to go with the concerns, so they didn't. And also, the mobile phone use was never challenged. There were, of course, a number of lessons learned from these cases. Practitioners don't always have the right training to recognise and respond to concerns. There was a lack of focus on the lived-in experiences for children. Professionals didn't work together, they didn't information share, and that's really important. And professionals need to demonstrate that professional curiosity and trust their instincts about abuse and actually act on that. And finally, keeping those records and sharing those in a timely manner as well. So now on to managing allegations against staff. In the case of Vanessa George, staff didn't know how to report the concerns or where to go with this information, and it's absolutely vital that our practitioners know this. So we'll now look at the process for this. So what would meet a threshold for an allegation? An allegation may relate to a person who works with children who has behaved in a way that's harmed a child or may have harmed a child, possibly committed a criminal offence against or related to a child, behaved towards a child or children in a way that indicates they may pose a risk of harm to children, or behaved in a way that indicates they are not suitable to work with children. An allegation can come from someone witnessing or hearing someone behave in one of the above ways, or it may come from something the child says, or it may be something that happens in a person's personal life. And of course, it could also come from the police or children's services. Whistleblowing. So if you have witnessed someone who has behaved in one of the ways previously mentioned, you must whistleblow. Whistleblowing is the process whereby an employee raises a concern about malpractice which harms or creates a risk of harm to the people who use the service, their children, employees, or the wider community. It's not the same as just making a complaint or raising a grievance. It's about situations where an employee has witnessed some form of malpractice in their workplace and needs to raise a concern. To ensure that whistleblowing takes place and children are safe, settings need to have those clear job descriptions for designated safeguarding leads, including their role in managing staff allegations. Staff and volunteers must read policies relating to whistleblowing and safeguarding, including signs of abuse. Regular training and whistleblowing should be a priority, including looking at cases such as Vanessa George, where it didn't happen, and the impact of that. Staff and volunteers must know who is the person to report to and be regularly reminded of this. And they should feel confident about challenging the behaviours of others and voicing those concerns. And they need to know who to contact and if they feel they're unable to report the incident within their organisation, they need to have that LADO number that they can access so that they know they can contact LADO themselves if they feel the need. Managers should know their duty to ensure the practice of whistleblowing is promoted and that there is a culture of reporting concerns and taking these seriously. And those safer recruitment practices need to be followed to prevent people who are unsuitable having access to our children. In a setting, there really should be a specific policy relating to whistleblowing, which is shared with all staff and volunteers. And it should state exactly what that whistleblower needs to do to report the concern and who to in that organisation. So what to do if you believe a person has done something to harm a child or put them at risk. So in the first instance, you must speak with your DSL and report this. Do not challenge the person yourself. The DSL then has a responsibility to take matters seriously, as must your organisation. Any concern raised about members or staff or volunteers have to be dealt with, regardless of who the person is. It doesn't matter how long they've worked for the organisation or whether they're directly employed by you. Confidentiality should also never be promised to the informant. The DSL should then contact the LADO as soon as possible, but within 24 hours to get their advice and follow their direction. A written record with all the details should also be made. A decision should not be made without seeking advice from your LADO, and you must not investigate anything yourself before speaking with them. In England, each local authority must have one or more designated officer whose role it is to manage and oversee investigations of allegations against people who work with children. So what will LADO do? Depending on the situation, there are a couple of different responses. Firstly, the police will need to investigate a possible criminal offence. Local child protection services may need to make inquiries or assess whether a child needs further support, or they might decide it doesn't meet their threshold and you should deal with the allegation through your own disciplinary procedures in your organisation. You'll need to cooperate with all the agencies LADO deem need to be involved, including providing any evidence to the police. If the allegation is against someone you don't employ directly, you will then need to involve the organisation they work or volunteer for as well. Every effort should always be made to maintain the confidentiality of all parties while an allegation or concern is investigated. LADO are there to support you through the process, and they will sort of tell you what to do. They'll consider the nature of the allegation and the best course of action. They'll inform you firstly whether or not it meets their threshold. Consider if we have enough evidence to establish the likelihood of the allegation being false or unfounded. They'll decide if further information is needed. They can tell you the best course of action and in what order. What should be said to the individual facing the allegation. Consider, does suspension need to take place for that member of staff? Advise how to support the employee, such as who they can speak to and where they can access mental health support, as until an allegation is proven or action decided, it remains an allegation and you need to consider their well-being as you move along the process. It's going to be really stressful for them too, especially if the allegation is found to be false or malicious, which of course is possible. They'll also advise you when to notify parents and carers of the child involved and how best to support that child. And they'll also decide if they need to convene a strategy discussion to plan any actions, such as police investigation or any other protective action. But just to note, suspension isn't always an automatic response. It should only be considered where there is further risk to a child or member of staff. And remember, suspension doesn't mean suspicion of guilt. It's just a neutral act to protect all involved. So once that investigation has taken place, there are a number of outcomes of allegation investigations. Firstly, substantiated. There's sufficient evidence to prove that it did happen. It's false. There's sufficient evidence to disprove it. It's malicious, so there was evidence to prove a deliberate act to deceive and it is false. It's unfounded, there's no evidence or proper basis that supports it, or it's substantiated, there's insufficient evidence to prove it. In all circumstances, every effort should be made to reach a conclusion, even if the individual refuses to comply or the person leaves the organisation. If the allegations were unsubstantiated, malicious or false, you'll also need to support the employee back into the setting and into their role for as long as they need this. Settings will also If they haven't already, notify Ofsted within the 14 working days of the outcome of the investigation. And if it is found that a person has carried out that harm to a child, you will also need to make a referral to the Disclosure and Barring Service for them to decide if the person is suitable to work with children in the future, and that's really important. So, how can we apply what has been covered to everyday practice and ensure our children are safeguarded? Have those clear job descriptions, identifying roles and responsibilities, strong policies and procedures which are holistic of all elements of safeguarding. Staff should be supported to act on all concerns for children, families and staff. Recognise, record, report, refer with clear and accurate record keeping, including the 4 W's: what, when, where and who. All evidence needs to be fact and not fiction, and this would be the actual voice of the child. Early identification and intervention should be promoted to prevent concerns escalating and the risk increasing. Signs noted and acted on by all. There should be quality training, support and accountability, which should be ongoing for all practitioners working with children. Professional curiosity needs to be encouraged in settings, and practitioners confident to professionally challenge others and other agencies on behalf of children if needed. And finally, all practitioners need to ensure they work in partnership with other agencies, communicating with these effectively and at all times. And that's all from me. So thank you very much for your time.
Wonderful. Thank you, Elizabeth. Another fantastic presentation there. Really appreciate that. Really thought-provoking, much food for thought that we can all take away, I'm sure. Thank you once again. Okay, wonderful. So that now brings the presentations to a close. Thank you all for your attention and engagement. I've seen lots of thumbs and hearts being put up on screen, and applauses. I see one there. Thank you very much. Much appreciated. I can't take any of the credit there. Thank you to the speakers. Wonderful, wonderful range of topics covered. Another huge thank you to the speakers. You've all been great.